welcome everyone back to another Dow Labs webinar. This is part of our Back to Basics series, and today we're going to talk about contraindications and dosages. So thanks very much, all of you, for being here, and let's get started. So our goals are pretty simple. As you can tell from the head, I'm going to spend a few minutes explaining sort of the dosage. That's a common question we get about our products, so we can understand how to use them correctly as practitioners. And then we're going to kind of review the Dow Labs products and just go over some of the contraindications, the known and contraindications, and some that I'll explain that are more based on sort of my experience, so you can kind of be more effective practitioners in using these formulas and get the most out of them, and avoid any unnecessary complications with your patients. So let's talk about dosage for a sec. Excuse me. I'm going to just introduce the formulas, and we'll get to dosage. So for those of you who are familiar with all of our products, here's a quick list of them and what the products are in Chinese. So we have what we call immunity support, is better known as jade windscreen powder in Chinese. Emotional balance is free and easy wanderer. Women's formula is the forced substance decoction. Digestive harmony is preserve harmony pills. Physical tranquility is a emperor of heaven elixir. Sometimes we also say to supplement the heart. Mental tranquility is our name for return to the spleen decoction. And joint vitality is our version of pubescent angelica and taxilis decoction. So these are like super useful formulas in your clinical practice, things you need a lot. So let's get to the dosage question. Each of these formulas is based on sort of classic ratios. These are the formulas that you have. These are the formulas you've encountered in your textbooks as you learned about them, with one exception, which I'll get to later in this webinar. So these are the formulas you probably know very well. To make our products, we use granulated herbs, and they're concentrated roughly to sort of a 5-to-1 ratio. But in the world of granulated herbs, that ratio is just a very rough number, and in actual practice, it isn't always quite that number. But that's sort of what everyone says. What we've done to kind of simplify things for you is we've pre-measured out the like a good dose, reasonable dose for your patients into our sachets, or in our other products, based on the scoop. So we've designed these sachets or the scoops so that each portion you get is a standard amount, and it's appropriate to take twice a day. The one slight variation here is, as you know, some of our products are in sachets, some of them come in tubs with the scoop. Is the joint vitality tub, and that one, a full dose would be 2 scoops. And mental tranquility and physical tranquility, 1 scoop is your dose. It is fine to take, we've done it too so that our dosage is slightly on the lighter side. So 1 sachet, 1 scoop, or 2 scoops for joint vitality is going to be appropriate for perhaps sort of a more petite patient, a woman, perhaps, and then be totally fine to do that twice a day. So that would be sort of our recommended dose when you're really trying to treat some more concerning problems. However, because we've got the actual individual doses slightly on the lighter side, we did that in mind that it's also fine to take like a 3rd serving in a day. So if you've got a patient who's really struggling with digestive issues and you've got having a particularly bad day, you're fine to recommend that they take up to 3 sachets of, say, like digestive harmony. And that's really kind of getting to the upper end of it, and maybe for your larger patients, heavier built patients, you might even encourage them to kind of stick with 3 servings a day over a period of time, as needed. In general, we would recommend that, however, that 2 servings a day is good. And for me personally, when I have a patient that's doing pretty well on a formula, I often kind of, once they're sort of made a lot of progress and I want to put them on a more maintenance type schedule, I'll often go to like 1 sachet, one scoop, if you will, per day, so that that can really sort of lock in the benefits. Now, we also get some other questions about the products. For example, we're often asked, can children take DAO products? Yes and no. We've done our dosages so that they're, the doses are really designed for adults, and certainly we'd say sort of kids 12 years or older. They're probably fine to take it. So we haven't really designed dosages for kid-sized dosages yet. It's probably a little bit complicated to be splitting things in half or something like that. If you feel comfortable doing that, you can. Chinese medicine is wonderful for all kinds of pediatric practices. But just for our customers, we tell them that they're not really for kids at this moment. We are planning on coming out with some pediatric lines where we really have dosages that are appropriate for kids. So that's coming in the future. But just to let you know that it's really designed for adults as we've done it at the moment. Can pregnant women take DAO products? Well, the answer is really, can pregnant women take? It's the same as can pregnant women take Chinese herbal medicine? Well, yes, it can be extremely important for certain conditions during pregnancy. So here, really, the answer is, I think it depends on your skill as a practitioner. These are all relatively safe formulas, but any formula, if used inappropriately, is not going to be a good idea for a pregnant woman. So if you don't feel comfortable in your use of herbal medicine and in your experience of dealing with pregnant women, I would definitely say stay away from that. You don't want to get yourself in trouble. You can certainly consult with an MD, but MDs aren't going to be really trained in these issues either. So just exercise caution in this situation. Basically, the answers are going to be yes, but with lots of caveats for this one. Can DAO products be taken with other medications? This is also, and really this is the same, this is the answer for this is the answer for all Chinese herbs. Yes, it's often done. As many of you know, I did all my training in China, and it's very common for people to combine pharmaceuticals with Chinese herbs. But we should remember, doctors in China are also highly skilled practitioners of Western medicine. They have a lot of training, a lot of clinical experience, and they really know the drugs very well. A lot of us practicing here in the US don't know our pharmaceuticals very well, and we don't really know how to think about drug interactions. So you'd want to proceed cautiously. You'd want to have, if you're nervous, or you want to have sort of an MD on your side, you want to be able to kind of monitor what's going on. So it certainly is possible. It's commonly done, but it's not something we recommend you take on by yourself unless you feel particularly knowledgeable about a particular pharmaceutical drug and your patient's response to that drug, and you've had some experience in combining Chinese herbal medicine with kind of the pharmaceutical drug in question. So those are a couple just standard answers to sort of questions on dosage and usage. I hope that's helpful. From here, let's move on to sort of counterindications. And I'm going to take each formula one by one. And just go over some basic, how the formula is used, but also when not to use it. So immunity support is our version of Yuping Fengshan, which is otherwise known as jade windscreen. It has the property of supplementing qi, in particular fortifying the exterior or the defensive qi. It's used to stop sweating, but it's also, or it does stop, that's part of its properties, it stops sweating, but it's used in particular to really fortify defensive qi so that you can be protected against sort of recurrent colds, upper respiratory tract infections, various kinds of allergies that are brought on by the assault of external pathogens. So this formula, it can be used very commonly, but at its base, it is a qi supplementing formula. It has one herb in it that fang fang or Shposhnakova, which drives out wind. But it's really designed for patterns of deficiency. So if you're encountering a pattern of excess, then this is probably not the formula for you. And in this case, if you've got patients who already have a cold or already sick with an upper respiratory tract infection, then this is probably not the right formula. Or maybe if at a minimum, it has to be used in combination with something else. Now, if a patient's struggling with allergies, you may very well be able to use this, particularly if that's, the presentation there is primarily sort of a deficient one, like a Qi deficiency. It's also probably, the herbs are slightly warming, so it's also probably not a great fit with like a deficient heat pattern or a yin deficiency, and probably likely to exacerbate that. So great for preventing kind of colds, but not great for treating them once you have them. Once you have that cold, the problem is really an excess, not unless a deficiency. So, or if you were to use it, you'd have to use it in combination with something else. Okay, great. That's immunity support. Let's take a look at emotional balance. This is a very popular formula. This is known as Xia Yao San in Chinese, or free and easy wanderer. And its property is to treat liver qi constraint while also supplementing spleen qi deficiency and liver blood deficiency. Sort of its classic sort of presentation are things like pain in the flanks, alternate sensations of hot and cold, headaches, fatigue, reduced appetite. But as you know from our name and perhaps your own practice, it's often used for stress or emotional volatility. Those are also signs of liver qi constraint. And that has a really wide number of uses clinically, particularly around in gynecology, women's irregular menstruation, breast tenderness, abdominal cramping, menopause, infertility. It can even be used in erectile dysfunction. And then it also gets used for various digestive issues or even things like chronic liver conditions. So a very, very wide range of uses. This formula is generally well tolerated. It's generally quite safe. So in terms of contraindications, I don't have a tremendous number of warnings here, but I guess in general, I would say the one thing for me that I try to be careful about is particularly conditions that are primarily deficiency patterns. Chaihu, which is one of the main ingredients in this herb, is thought to sort of steal or thieve the yin from the liver. So it can stress the liver if given too much or over too long of a period of time. So in those situations where you really see the deficiency and you're worried about perhaps the formula itself kind of stressing the liver as it's continuing to sort of dredge it, then this is probably not the right formula for you. So that's my main contraindication for this one. Digestive harmony. This is our version of Bao He Wan, which is Preserve Harmony pill. And as many of you know, this is a great formula for reducing food accumulation. That's sort of the technical term, and harmonizing the stomach. In practice, we often use it to sort of relieve indigestion, particularly when we overindulge in rich foods and alcohols, or if we've encountered some foods that are not clean, sort of a food poisoning type situation. Often it presents with, these patterns include sort of presentations of abdominal bloating, pain, reflux, belching, vomiting, loose stools. So this formula is a wonderful formula. It does have some contraindications. So this formula is considered a mild formula in the realm of sort of the formulas that reduce reduce and guide food accumulation. But it's nonetheless, these types of formulas are not meant for sort of ongoing long-term use because they are sort of trying to break up that accumulation of food, that stoppage of food, and get things to descend. So again, this is a quite mild formula, but if you were just to use it continuously for months and months, you might you might have patients that start to develop some discomfort. It's not going to happen too quickly, but they might over time. In that situation, it may still be very good to use it. You might just need to pair it with a formula that balances it some. So perhaps something like 4 Gentlemen's Decoction, or a version of that, something with that supplements spleen qi. And then you might have this, proper balance that you really need. So again, not something to get too worried about right away, but just recognize that down the line you may need either to pair it with something else or to kind of use it a little bit more sparingly. And often when I have patients who really use it long-term, I'll try to pretty quickly get them onto that sort of more maintenance dose, or have them use it sort of as needed, maybe a couple of times a week. And in that situation, you're probably not likely to have any issues. Okay, let's go on to women's formula. This is our version of Su Tang, or the 4 substances decoction. This is an extremely important formula in gynecology, Chinese medicine gynecology. It supplements and harmonizes the blood. It's used for various kinds of menstrual irregularities, light periods, for instance, caused by blood deficiency, but also heavy periods leading to blood deficiency. It may be very effective for lower abdominal cramping. It can be great for postpartum pain and heavy blood loss and just recovery in that postpartum period. So wonderful, important, extremely important in gynecology and just in supplementing blood in general. It does have some contraindications. All these herbs tend to are on the warming side, so it's not a great formula for using with patterns of yin deficiency. So you're looking for patterns of blood deficiency, not yin deficiency. And the difference here is that patterns of yin deficiency are going to present with some kind of heat, some kind of deficient heat. Patterns of blood deficiency are going to tend to be patterns of more like a deficient cold, if you will. So in your practice, you want to be able to kind of distinguish between hot and cold. If you see clear signs of heat, of this deficient heat caused by yin deficiency, then this formula is ultimately not going to be the best fit, or needs to be paired with something else. And then it is a formula that supplements blood, but it's not for treating severe blood loss. So we're talking about hemorrhaging, serious hemorrhaging. That can be an emergency, and may require a trip to the ER and all sorts of other interventions. But we shouldn't sort of confuse the fact that this blood supplementing formula it supplements blood, but it doesn't stop bleeding. So that's a distinction we need to be clear about. Okay, so that's women's formula. Next, we're going to talk about mental tranquility. So this is our version of Gui Pi Tang. This is a fabulous formula. We sell it as one of our sleep remedies. We sell 2 sleep remedies, and extremely effective at supplementing qi and blood. It strengthens the spleen and nourishes the heart. We strongly recommend it for patients with disrupted sleep or insomnia that present with a heart spleen deficiency is sort of the standard pattern in Chinese medicine. So you might see here heart palpitations, forgetfulness, reduced appetite, fatigue, kind of a sallow complexion. And as I've talked about in other webinars and other lectures, the key is to look for that kind of pale, puffy tongue with teeth imprints. So I've got a little image right here on the screen. That's sort of essential to your diagnosis. So if you don't see a tongue like that, or you've got a patient who might fit this, you think fits this pattern, but you don't quite see a tongue like that, then you might want to start thinking about your contraindications. Now, in this case, this formula is used very widely for a lot of things, and it's going to be generally pretty safe. But I would say in my experience, probably it's not going to be a great fit for patients, particularly if you're trying to treat insomnia where the real culprit is some sort of damp heat. So in this case, you're going to see redness in the tongue, So that would be one kind of concern right there, a red tongue as opposed to a pale tongue. And then also like a very thick kind of greasy coating. That's going to be an indication of dampness and phlegm. Those two together are kind of going to require some different strategies to address. And I've talked about that in some other webinars as well. But you may find that this formula actually exacerbates the insomnia in that situation, because you're just the warming herbs that are already in this formula may be adding more heat to the problem, and the supplementing herbs that sort of supplement qi and blood may end up sort of actually increasing dampness and heat. So that's Gui Pi Tong, mental tranquility. But otherwise, this one a little bit like I would say, well, all of our formulas are all quite safe in many circumstances, but this is maybe a little bit closer to emotional balance in terms of its wide array of uses, and you're generally going to be pretty safe with it. Okay, next we've got physical tranquility. So this is our other sleep remedy. This one is for treating a kidney yin deficiency along with a heart blood deficiency. So a different pattern than mental tranquility. You're also going to see presentations of restless sleep, heart palpitations, but you may have excessive dreaming. That's a sign of some deficient heat, more so than you would with Gui Pi Tong. Forgetfulness is common to both, but here the key is really going to be looking for the tongue. So you want to look for, and I've got an image here, you want to look for a red tongue with little to no coating or perhaps cracks. And that's going to be the key. If you see that red tongue, and either no coating, little coating, or a geographic tongue where it's all broken up, then you're going to be safe to use this formula. This formula, it's a great formula, but it does probably have a few more contraindications, I'd say, than some of the previous ones. Here you're going to want to be careful to, and the tongue is going to be your friend here, to not give it to patients who have like a spleen qi deficiency of some kind or some spleen stomach issues. And the reason is this formula has a large number of cooling herbs in them. And as you know from your training, sort of cooling herbs, they're kind of cooling and cloying, if you will, heavy. They can over time injure the spleen and stomach. So you may see in some of your patients, you may start off with a tongue like this, and you may find them doing quite well for a while, but then gradually over time, the cooling herbs can become too much. It may take a while, but I've had that happen. So here we just want to be careful about extended long-term use. It's unlikely that you're going to have, if you've got sort of this presentation and sort of that correct tongue, it's unlikely you're going to have like a real negative reaction to it immediately. But if you've got patients who already have some spleen stomach issues, then you'd want to proceed cautiously. And I do want to make a quick note here to tell you that the version of Tianwan Bu Xin Dan that we use here for physical tranquility is slightly different than what you find in your standard textbook entries. The version we use, it is still a classic formula, just one that's used a little bit less common, but we like it because it actually has a smaller percentage of Shengti Huang. So this is Romania, and this herb is quite cooling. So by having a smaller percentage of this herb, we feel that it's going to be more gentle on the stomach than sort of the classic one. The classic one actually has a very massive dose of Romania, of fresh Romania. And because it's quite cooling, that's going to, in time, that's going to just be hard on the stomach. So we're also very pleased that we've got this interesting version of the formula. Okay, and then let's go on to our last one, which is joint fatality. And in Chinese, this is Du Huo Ji Sheng Tang. And this is a great formula for treating blockage syndrome or B syndrome or obstruction syndrome, depending on how you translate it. It dispels wind and dampness and cold to some extent, and treats the pain of blockage. It also is a supplementing formula that supplements the liver and kidneys, it tonifies qi and blood. So this formula is excellent for chronic joint discomfort. It really strengthens the lower back and knees. Um, it does have some contraindications, but and here you probably just want to make sure you do a good consultation with your patient, look at their tongue, and you'll probably be okay. But it's not going to be great for sort of damp heat patterns. This is it is a warming formula. And so if you encounter sort of damp heat formulas, the supplementing herbs and the warming herbs together are going to sort of intensify that damp heat probably. Now in B syndrome or blockage, heat is usually not our main concern. So we usually have wind, dampness, and cold. Those are our three main sort of pathogens that sort of drive the B syndrome. And so if you've got wind, cold, and dampness, this is a great formula. Just if that cold transforms into heat, and then you've got a damp heat pattern, that's where you might start to see some negative reactions. And a number of other formulas in the Chinese herbal formulas that treat B or blockage are formulas that are much more the sort of pure excess patterns. The pure excess patterns are the patterns of wind, cold, and dampness. And those will have, this could be Juan B Tong as a classic example. These formulas have the warming, drying, wind dispelling herbs in them, but they don't usually have the supplementing herbs in them. This particular formula does have a significant number of supplementing herbs in it, so it's really going to be for these mixed patterns of excess and deficiency that it's the best fit. Now, I think in my clinical practice, I find that a lot of patients have like complicated mixed patterns of excess and deficiency. So I find this form to be extremely useful, particularly for older individuals, middle-aged individuals. There's often going to be a mix of those two patterns of excess and deficiency. But do be aware. Typically, for me, I often will, before I prescribe this, I want to at least look at the patient's tongue and just make sure it's probably on the paler side, and I don't see like any real obvious sense of heat, and maybe a very greasy tongue, don't see like a greasy coating on it. Then I'll feel quite comfortable taking this. And this is a formula when it is a good fit. It's the sort of formula that you can often take for quite a long time. Those are my kind of quick summary of contraindications for our formulas. I hope that's helpful. I wanted to remind you too about, especially at this moment during COVID-19, when it's hard to get all your patients into your clinic, that we want to encourage you to use your link and code, and make sure you've got your clients, your patients using it so they can get a discount on their orders. And we want to recommend that you enter all your patients into the managed leads area of the practitioner dashboard. And once your patients are in there, regardless of whether they use your code or not, that ensures that you get your commission on their orders when they're making them at home or outside your clinic. We've got great patient summary cards too for sale now if you want to use those. I find that very useful to give patients a couple quick notes on sort of what I wanted them to do for the week and how to use the formulas. And those are available in our resource room. If you've got any other questions about the company, strongly encourage you to contact Jen Ward. She's fabulous, and she should be able to answer all your questions and really spend some time with you to make sure you understand how the website works and understand more about the products. We want you to also stay connected, and so going forward, we're planning on webinars for the first Wednesday of every month. So that should be fun. If you've got topics that of our particular interest to you, please let me know or let Jen know, and I'll try to work them into my schedule. I don't have any really definitive plans for the upcoming webinars in the next few months. We also want you to check out our Facebook group for some more practitioner insights. Please read our bi-weekly newsletter, The Pulse. And thanks for coming to this webinar, and thanks for your interest in Dial Labs. And let us know how we can help you, and look forward to seeing you at the next one.